Hi everyone, how are you doing? My name's Stephanie Chivers, and I am a coach and a trainer. I do a lot of work in behaviour change. I'll just do a little intro about myself, but I won't go on, just to give you a bit of context about why I'm here and why I'm doing this video. But essentially, I'm going to talk to you about alcohol and physical addiction so that it helps you make an informed choice about what you're doing with your drinking. So I've done pretty much every job there is to do within drug and alcohol treatment services, drug and alcohol worker, young persons worker, prisons worker, psychiatric units, secure units, family worker, team leader, group worker, you name it, I've done it, all the way up to service manager. And I have run 3 different treatment services, 2 of which were alcohol specific. And a large part of that as well was about supporting the wider community and training other workers, GPs, social workers, health visitors, nurses, midwives, and just supporting the work that they did in the community as well. Now I am director of a small community interest company, but I also do a lot of work supporting other community interest companies, businesses, freelance coaches, anybody in the alcohol-free space, really, to support, encourage, upskill, train them to be better at their work, essentially. So one of the things I'm very good at is assessing physical dependency around alcohol, and I train a lot of people in how to do it. Unfortunately, it's not a simple thing to explain, and this video is not going to give you what you need to be able to assess the risk associated with physical dependency. What it's going to do is give you the highlights to give you a bit of understanding, and then hopefully be able to figure out whether you need to get some more help. Okay, it sounds like it's a dark art. Do you know what? It feels like it because there's so much involved in it. Being able to assess physical dependency with alcohol is not a simple thing. It's an ongoing process, you know, where we usually involve clinical supervision, a lot of risk management. Okay, so here is the thing. Alcohol is a drug. It is a physically and psychologically addictive drug. Now, what that means is, so lots of drugs are psychologically addictive, okay, but very few of them carry the risk of physical addiction. Alcohol carries the risk of physical addiction. This means that if we drink significant amounts of alcohol regularly, now whether that's daily or in a binge pattern, so you can still build up a dependency in a binge pattern, and we stop drinking suddenly, we would experience physical withdrawal symptoms. Now, the reason why everybody's like, it's really important to know about this is because withdrawal from alcohol carries the risk of death. Okay, now just to put this into some context, if I saw 100 people in alcohol treatment services, maybe 10 of those people would have signs of physical withdrawal. Maybe 5 of those people would need a medical detox, and only a very small number of those people would potentially be at risk around death in terms of withdrawal. Okay, but the problem is we just don't know. So I want to give you the information so that you can get the support to help you to look after yourself, essentially. Okay, so how we assess physical dependency around alcohol is not just about the amounts of alcohol you drink. There are many factors involved. So our age is a factor, because as we get older, our alcohol impacts on us more. So for instance, you know, we would be concerned about somebody drinking 2 bottles of wine a day, maybe in their 30s. But then when you get into your 60s, somebody drinking a bottle of wine a day, we would be concerned about that. Okay, so your age is a factor. So as you get older, that's putting you at more risk with less alcohol. Gender also. So women are at more risk than men. Our mental health, what medication we're prescribed, and any physical health problems we have as well are a factor. And I'm not going to go into all the specifics because that's literally an 8-hour training. It's just to give you some of the headlines. Now, to give you a guideline, the types of things that we're concerned about are, so for a woman, if a woman is drinking 18 units a day, now remember that changes when we're looking at sort of over 60. It's not really a cut-off point at 60, but as you get older, you know, the less you drink is more of a problem. So as a woman, if you're drinking 18 units a day, now 18 units looks like 2 bottles of wine, then we would be wanting to assess physical dependency. Now, that does not mean if you're drinking 18 units a day, you have a physical dependency. I have met women that do not have a physical dependency. And it's rare, if you're drinking less than that, it's rare. In fact, I think I've only come across it once where somebody has a physical dependency to alcohol drinking less than 18 units. So 18 units is a good baseline to work with. However, if you have any mental health diagnosis or taking any medication or any physical health stuff, we would still want to err on the side of caution. I would not want you to be reducing on your own. I would want you to have a proper assessment with a medical professional or a specialist alcohol worker, someone like myself who is trained in alcohol assessment, okay? Now for a man, we're looking at about 24 units, so that looks like around 10 to 12 pints of lager. Now, I have worked with a lot of men who are drinking that amount and more and have no signs of physical dependency. So it's just a bit of a guideline. I haven't come across any men drinking less than that with a physical dependency. It doesn't mean they're not out there, but you know, given the thousands and thousands of people we've worked with in alcohol services, that's a pretty good baseline. Again, it's not just the amounts of alcohol. So if you're drinking less than 24 units as a man, but you have a mental health diagnosis, you're taking medication for a physical health problem or a mental health problem, or you have a physical health issue, I would still want you to be assessed by a medical professional or a specialist alcohol worker that can do the assessment, okay? Now, the thing to remember here is this isn't just about daily drinking. This can also be if you are a binge drinker. So for instance, if you drink Thursday, Friday, Saturday, and you drink large amounts, you stop suddenly, there's a potential that you may go into a withdrawal, okay? This also counts for relapse. So great that you want to be alcohol free, that's fantastic. But sometimes what happens is we have a blip, slip, relapse, you know, and if we're drinking quite a lot and we stop suddenly, there is a risk around withdrawal there as well. Okay, so withdrawal symptoms are sweating, shaking, anxiety, paranoia, psychosis, hallucinations, whole body shakes, and fits. Okay, so usually what we see first when somebody stops drinking is the hand shaking and the sweating. Okay, so that's a sign of withdrawal. Now, this is going to sound counterintuitive, but the advice we give is to have a drink to manage your withdrawal symptoms, okay? I mean, obviously you can call your doctor, but whether you can get a doctor on the phone in time, whether your doctor is interested in supporting you with alcohol withdrawal, there are many ifs and buts there, okay? Usually a doctor or a specialist alcohol worker will advise you to have a drink to manage your withdrawals until you can get some proper support. So places where you can get advice if you're concerned about this. So obviously talk to your doctor. You can self-refer to an alcohol treatment service. If you Google alcohol treatment service in your area, it should come up. Now, you may or may not get seen by your alcohol treatment service. You may or may not want to, that's absolutely fine, depending on the area and how busy they are and their risk threshold. Or you can message someone like myself who is trained to assess this type of thing. Anybody who's trained to assess alcohol withdrawal should offer free consultations for exactly this reason, so we can figure out what would be the best course of action. So if you think you do have a physical dependency to alcohol and you want to stop drinking, we recommend a reduction program. Now, you can do what's known as a medical withdrawal. However, sourcing that in the UK is quite difficult. In the US, it's a lot easier. So for instance, your doctor probably won't be interested in providing you with a medical detox. It's always worth a go, because if they do, that's amazing. Treatment service, again, will depend on whether you meet their thresholds, and you may or may not be able to find a private prescriber. Currently, at the moment, I don't have any private prescribers that I recommend, unfortunately. However, for some people, being prescribed medication to support them to come off alcohol can be a very effective way of doing it. And when I've worked with clients to do it, it has been phenomenal. However, you don't have to do that. So sometimes I've worked with people who have been physically dependent on alcohol, and they've been unable to source the medication from their doctor. Alcohol treatment services won't support them. They don't have the money for a private prescriber. We have done a reduction program. Again, if you're a daily dependent drinker, I recommend that you work with somebody who is trained to be able to support you with a reduction program. However, something that we do say is that for most people, reducing 1 unit per day is probably going to be okay. Yeah, so 1 unit per day requires that you measure out that alcohol and you throw it away and you keep track of what you're drinking. The idea is that if you were reducing 1 unit per day, then, you know, obviously if you start to struggle with withdrawal, you would stop and you would maintain and talk to a specialist alcohol worker. I hope that's made sense. The key bit here is that you look after yourself when you are making decisions about what to do with your drinking. Okay, thank you. Bye.